discuss here, so it is very difficult for the finger to become straightened. It is very difficult to finger to straight. Okay, so this is almost similar to triggering finger. Okay, but in triggering Assalamu alaikum and welcome to our YouTube channel. My name is Dr.Syed and in this video we will talk about a condition called Dupuytren's contraction. Alright, so Dupuytren's contracture is basically a condition where which involve your one or two fingers. Alright, so basically this Dupuytren disease mainly affects the ring or little finger, but it's sometimes it is commonly affect on the both hands, and it's maybe usually grow very slowly, so it can affect on one hand or two hand, but usually involved with the fingers of your hands. Okay, so the presentation of this disease is basically your fingers are bent towards the palm. Okay, like in this condition your fingers are maybe one finger or two finger or more than two fingers, they bend towards the palm, and but it is very difficult to straighten your finger. Okay, so this condition is very similar to the another condition called triggering finger, but in the triggering finger the mechanism is different. In triggering finger, basically the tendon of the fingers are involved, but in this condition, Dupuytren's contracture, in this condition basically the problem is in the fascia of your hand or finger. Okay, is not related with the tendon. Okay, so as we said, so it is basically a movement position of your finger are in this position, if they are in the flex positions, and initially it is not very painful, but it can progress to the it usually start with the lumps or thickness around your palm or finger, and gradually progress and where your finger become permanently bent position or flex position, and your fingers become stuck, or it is very difficult to move your finger in the straight position. The reason for the Dupuytren's contracture, usually the tissue under the skin. Okay, the tissue under our fingers or under the skin near our finger become thickened. Okay, due to thickness of the tissue, it is very difficult to move our fingers, or it usually affect the palm as well. The fascia under the palm become thickened in this condition, and it is also it involve the palm and fingers. Okay, sometimes it is only involve the finger, not the palm, but in most of the cases the palms and fingers both are involved. Okay, the exact cause is unknown, but it is usually due to the family history of the condition and smoking, drinking alcohol, or if you have any other condition like diabetes or epilepsy, so your chances of getting Dupuytren's contractures are higher as compared to other people. The main symptoms discussed here, so it is very difficult for the finger to become straightened. It is very difficult to finger to straight. Okay, so this is almost similar to triggering finger. Okay, but in triggering finger, when usually the reason for the trigger finger is tenosynovitis, or inflammation of the tendon that causes your tendon to, or it involves the pulleys to be thickened around your tendon. But in this Dupuytren's contraction, the mechanism of the mechanism is quite different. It only involves the the almost symptoms are almost similar, but the mechanism of the different. Okay, so it involves the fascia around the fingers and palm. Okay, initially, as we discussed, the knot of the tissue under the skin usually create a thick cord that pull the finger in the band position. The cords around the uh, hair, like in the finger, and can it usually uh, usually gradually getting very worse, or you can feel the pain around your finger and you have very difficulty and when you bend your finger. So but also you usually feel a lump or thickness around your in the palm or around the finger. Okay, um, also as we discussed, the unknown, the cause is still unknown, but the some of the uh, it usually develop after the age of the 50 years, more common in men as can other than women, but the trigger finger is usually common in women. Okay, and the family history also involved. If you have family history of this condition, you are at risk of developing this condition. Also, the diabetes and alcohol use is also a risk factor in this Dupuytren's contracture. All right, so the treatment options are basically surgical options are available. For example, the fascia around the finger, they usually treat with the fasciectomy. Okay, they usually made a cut around the finger and they perform some type of plasty or that plasty around the finger, and they basically cut the fascia around the finger, because this disease is due to the inflammation or due to the thickness of the fascia. So after the fasciectomy, this condition resolve when you are able to move your finger. So they usually use sometimes this surgery performed under general anesthesia, and sometimes they perform under local anesthetic. For example, if they are doing needle fasciotomy, they use different types of needles. Okay, they use different types of needle and they place the needle around the palm and the fingers to loosen the fascia. Okay, after the needle fasciotomy, this is one of the treatment for treating Dupuytren's contracture. And if they are removing the skin around the palm or around the finger, then they use a skin graft from the body to replace the removed part of the skin. Okay, so these procedures basically are very effective and they usually treat. Alright, if you're new to this channel, please like and subscribe our channel and share this video to your family and friends.